Welcome to the vomitorium, where the competition is stomach-churningly fierce. That's right, the Olympiad of events in this sketch is not for the faint of gut. But as our athletes try to keep up, we'll explore nausea and vomiting and the drugs used for treatment and prevention. Numerous conditions cause vomiting, like infection, medications, vestibular dysfunction, radiation, chemo. With so many sources of things making us want to vomit, it's no wonder there are multiple pathways for these sources to be translated by our brain into a vomity output. All right, the first event begins on the tractus. A convenient place to start since the actual act of vomiting starts at the nucleus tractus solitarius, or NTS, also called the solitary nucleus. The NTS receives input from various locations in the body and then coordinates the vomit response by sending signals to nearby nuclei in the medulla to get things moving. We'll go through the input sources one by one, and then we'll go through the antiemetic drugs that typically block these normal inputs one way or another, mostly by blocking various receptors. Not to miss out on a chance to advertise, Las Vegas is sponsoring the Happy Hammer Throw. But athletes will need more than luck throwing hammers because it's a long way up to the brain from the stomach here. Thankfully, the GI tract directly communicates with the vomiting center, mostly via cranial nerve 10, the vagus nerve, and just a little bit via cranial nerve 9. Conditions that cause GI irritation, such as infections, chemotherapy, or distension, can cause enterochromaffin cells, those neuroendocrine cells in the lumen of the GI tract, to release serotonin. And since serotonin is the neurotransmitter that makes you happy, our recurring symbol for serotonin is the smiley face, like on these hammers. Serotonin then activates 5-HT3 receptors on vagal afferent nerves, which relay their impulse to the NTS, causing emesis. With the hammer throw underway, let's head to the semicircular canal. Excessive stimulation of the vestibular system results in activation of muscarinic M1 and histamine H1 receptors, which send their signals to the NTS via the vestibulocochlear nerve, or cranial nerve 8. This is the system responsible for vertigo and motion sickness, also called vestibular nausea. Notice a couple recurring symbols along this canal: the beehive for histamine receptors and the motor parking spot labeled M1 for muscarinics. Moving along, this trigger zone landing pad is a reminder of the chemoreceptor trigger zone, or CTZ, located within the area postrema, right next to the vomiting center in the brainstem. To remember area postrema, just remember the intense postures those gymnasts have to hold on that pommel horse in the rings. There's a poorly developed blood-brain barrier here so that this area senses emetogenic substances in the blood and in the CSF in the fourth ventricle just next door. The CTZ holds many receptors, including dopamine, serotonin, histamine, mu, NK1, among others, involved in the vomiting response. And it also acts as a relay center for vagal afferents going to the NTS. Finally, higher centers in the brain, including the meninges, thalamus, and hypothalamus, can cause stimulation of the NTS, so that just the thought of chemo can make one want to hurl. We call this anticipatory vomiting. This is also why the vomit response can occur just by seeing, hearing, or smelling someone else vomit. All right, after that quick tour, let's move on to the drugs that block these inputs. The hammer throw competition continues, but hold up. It seems a dancer has forgotten his boundaries and danced right onto the field, blocking the event quite effectively. And kind of like this blocking dancer, ondansetron is a selective antagonist, or blocker, of the 5-HT3 serotonin receptors on the vagus nerve afferents, thus preventing the vomit signal from getting sent up to the brain. Notice that ondansetron and all its cousins, granisetron, dolosetron, palinositron, almost have the word serotonin in their names. Serotonin, cetron. So that can help you remember that we're dealing with serotonin here. Since we're in the GI tract, it makes sense that these drugs are most useful for preventing nausea and vomiting due to GI irritation and damage, such as from chemotherapy or radiation, infections, or postoperative inflammation or distension. For chemo, these are best for during or shortly after chemo for acute nausea when damage to the GI system is highest. The 5-HT3 inhibitors are usually very well tolerated, but they still have side effects. Speaking of side effects, a side effect of budget cuts at this year's Olympiad seems to have led to repurposing some equipment. Well, let this plunger baton remind you of the constipation caused by ondansetron, which can be very uncomfortable. Other side effects include headache and dizziness. Equipment issues aside, fortunately, our dancer isn't without his ribbon, which kind of looks like a twisted streamer, our symbol for torsades. Agents that block 5-HT3 receptors can prolong the QT interval, which can result in torsades. So these should be avoided in patients with an already prolonged QT, either congenitally or from other medications. Finally, let the whole pile of smiley face hammers remind you of serotonin syndrome, the rare but potentially life-threatening condition associated with the use of 5-HT3 receptor antagonists causing high levels of serotonin. It's more common with the concomitant use of other serotonergic drugs like SSRIs. All right, while this dancer situation gets sorted out, the canoe race is finally underway along the semicircular canal. Did we mention the competition is fierce? And we're not just talking about the athletes. These bees can be quite the obstacle. Fortunately, this experienced canoeer came prepared with a bee swatter, our recurring symbol for antihistamines. Antihistamines are medications that block histamine receptors, and here we're referring to the H1 receptors found in the vestibular system. Remember that the first-generation H1 receptor antagonists, such as diphenhydramine, meclizine, and promethazine, do cross the blood-brain barrier and block those H1 receptors in the vestibular system, making them useful for treating vestibular nausea or motion sickness. The Life Vest 2 should remind you of the vestibular system and vestibular nausea. Also acting in the vestibular system are the anti-muscarinic drugs like scopolamine, symbolized by this telescope. See how it's blocking that M1 parking spot? Scopolamine blocks M1 receptors in the vestibular system to also treat vestibular nausea or motion sickness. Hence, the boat that can no longer park there. We've covered both the antihistamines and anti-muscarinic drugs in more detail in their own sketches, so check those out for all the anticholinergic side effects induced by both of these classes of drugs. Well, looks like this canoe race has a clear winner, but gymnastics is still in full swing. Somersaults and backflips don't exactly pair well with nausea and vomiting, or maybe they pair too well. But have another look at these D-shaped rings. Because the dopamine D2 receptor is a major receptor within the chemoreceptor trigger zone, it's a target for therapy. After a top-notch performance, this gymnast fell and couldn't quite stick the landing. Might have something to do with those metal clogs she's wearing. This unusual footwear is a reminder that there are several D2 receptor antagonists for antiemetic therapy, with the most common being metoclopramide, hence the metal clogs. Since the CTZ is chock full of D2 receptors, antagonists of these receptors are very useful for preventing chemotherapy-induced vomiting, particularly delayed type, well after the chemo is given, as the chemo and its byproducts are still floating around in the blood and CSF. Metoclopramide also helps with migraine-associated nausea, along with the pain of the migraine itself. Keep in mind that blockage of D2 receptors has a prokinetic effect on the GI system, increasing gastric emptying. Hence, metoclopramide is indicated for the treatment of delayed gastric emptying post-surgically and in diabetic gastroparesis. But this prokinetic effect contraindicates metoclopramide in cases of bowel obstruction, where it can actually worsen things. That prokinetic effect also means there's a chance of diarrhea, which brings us into the adverse side effects of D2 antagonists, of which there are quite a few. The most common adverse effects of metoclopramide are caused by D2 receptor blockade in the central nervous system, and they're more common and severe in elderly patients, including fatigue and drowsiness and depression, which we've illustrated with this encounter between the gymnast's saddened coach and the sleeping judge. And because we're blocking dopamine receptors, extrapyramidal symptoms are also possible, symbolized by this other judge's pyramidal-shaped hat with the word extra, including dystonia, akathisia, Parkinsonian features, and also tardive dyskinesia with chronic use, hence his stuck-out tongue. Well, this judge isn't sleeping, but I'm not sure he's paying a whole lot of attention. What about the other judges? Ah, of course, lunch. This now more spicy chicken symbolizes neuroleptic malignant syndrome, which is normally seen with antipsychotics, but it can also occur with the D2 receptor blocking antiemetic drugs. And this milk spraying way up high symbolizes elevated prolactin levels caused by D2 receptor antagonists, which can cause galactorrhea, gynecomastia, impotence, and menstrual disorders. Like ondansetron, metoclopramide can cause QT prolongation and should be avoided in patients with long QT syndrome or on other medications that prolong it. Note that metoclopramide isn't the only D2 antagonist useful for antiemetic therapy, however. Others include prochlorperazine, a first-generation antipsychotic, which also inhibits H1 and M1 receptors, and olanzapine, a second-generation or atypical antipsychotic, which also inhibits 5-HT3 receptors. As with metoclopramide, watch out for the extrapyramidal side effects with all of these centrally acting drugs. Learn more about these drugs in the antipsychotic pharm sketches. All right, let's leave these judges to their judging and take a look at the pommel horse plank event. The words plank 1 with the emphasis on the NK1 should remind you that neurokinin 1 receptors are also found in the CTZ. Checking for substances in the P has become routine in the past few years for this Olympiad, and it should remind you that substance P binds to the NK receptor. Also, the word participants is a reminder of the highly selective NK1 receptor antagonists, aprepitant. Aprepitant crosses the blood-brain barrier to occupy and block those NK1 receptors in the NTS and CTZ. This drug is often combined with a 5-HT3 antagonist and dexamethasone to prevent nausea and vomiting from highly emetogenic chemotherapy. Though its high specificity means it doesn't affect other receptors, thus minimizing its side effects, it can still cause some diarrhea, fatigue, and dizziness, and may be associated rarely with neutropenia and hypersensitivity reactions. Okay, so we've covered the major antiemetics, but let's not forget that there are other medications that can be used. Glucocorticoids like dexamethasone and methylprednisolone are useful for chemotherapy-induced nausea and vomiting, and enhance the effect of 5-HT3 antagonists, so they are often used together for chemo-induced vomiting. Benzodiazepines like lorazepam can also be used for chemo-induced vomiting, hence this advertisement for one of the sponsors, Ben's Diner. Finally, cannabinoids can be used for chemo-induced vomiting, acting on CB1 and 2 receptors, though their use is limited by their side effects from the psychoactive agent in cannabis, which can be intolerable to patients. Well, it seems like these games are wrapping up, so we'll wrap up too. Choosing an antiemetic therapy depends on the type and location of the emetogenic stimulus. Though after the stimuli, the act of vomiting itself starts from the nucleus tractus solitarius. Anything that can irritate the GI tract, including chemotherapy, infection, distension, or surgery, can cause serotonin to be released, which activates 5-HT3 receptors on vagal afferents that communicate directly with the vomiting center. Block the nausea due to these stimuli with ondansetron and other 5-HT3 antagonists. Remember, they end in cetron. But watch out for serotonin syndrome and torsades. Motion sickness is sensed by the vestibular system. Block this vestibular nausea by blocking either the H1 receptors with first-generation antihistamines or the M1 receptors with scopolamine. Any emetogenic substance found in the blood or spinal fluid, including chemotherapeutic agents, will activate the chemoreceptor trigger zone within the area postrema, found outside the blood-brain barrier. Block nausea due to these stimuli by blocking D2 receptors with metoclopramide or by blocking NK1 receptors with aprepitant. Blocking central D2 receptors causes many neurological side effects and may cause torsades. But also remember that there are D2 receptors in the GI tract, allowing metoclopramide to act as a prokinetic. And there are many other drugs that may have antiemetic properties, such as glucocorticoids, benzodiazepines, and cannabinoids, so they can also be used, often in combination with other meds. And that concludes another Olympiad at the vomitorium. Now, where did I park my boat?